Breast cancer is a type of cancer that forms in the cells of the breast. It can occur in both men and women, although it is far more common in women. The cancer can develop in various parts of the breast, including the milk ducts, lobules, where milk is produced, or in the fatty tissue. Before we go deep into breast cancer, let's briefly talk about what cancer itself is and if there are other types. Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. These abnormal cells can invade and damage surrounding tissues and may form masses or tumors. Types of cancer. There are numerous types of cancer, based on which part of the body is affected, as it can affect virtually any part of the body. Some common types include lung cancer, develops in the lungs and is strongly associated with tobacco smoking. Prostate cancer, occurs in the prostate, a small gland in men that produces seminal fluid. Leukemia, a type of blood cancer that affects the bone marrow and blood. Ovarian cancer, occurs in the ovaries, the female reproductive organs. Pancreatic cancer, develops in the pancreas, an organ involved in digestion and blood sugar regulation. Now, let's continue with breast cancer. What are the risk factors of breast cancer? Risk factors are different from causes of cancer, but they are factors that can trigger the development of breast cancer in the body. Gender, women. Women are at a higher risk of developing breast cancer compared to men. Age. The risk increases with age, and the majority of breast cancers occur in women aged 50 and older. Family history. Having a first-degree relative, mother, sister, or daughter, diagnosed with breast cancer increases the risk. Genetic mutations. Inherited mutations in genes such as BRCA1, BRCA2, TP53, and others can significantly elevate the risk. Hormonal factors. Early menstruation and late menopause. Women who began menstruating before age 12 or experienced menopause after 55 have a slightly higher risk. Hormone replacement therapy, HRT. Long-term use of combined hormone therapy after menopause may increase the risk. Reproductive factors. Nulliparity. Women who have never had children or had their first child after age 30th of May have a slightly higher risk. Breastfeeding. Some studies suggest that breastfeeding may have a protective effect. Personal history of breast cancer or certain non-cancerous diseases. Previous breast cancer. Women with a history of breast cancer are at a higher risk of developing a new primary cancer. Radiation exposure. Previous chest radiation. Individuals who received radiation therapy to the chest, e.g., for Hodgkin lymphoma, have an increased risk. Dense breast tissue, breast density. Women with denser breast tissue may have a higher risk. Alcohol consumption. Consuming alcohol, even in moderate amounts, is associated with a higher risk. Race and ethnicity. White women. White women have a slightly higher incidence of breast cancer, but African American women are more likely to die from the disease. It's important to note that having one or more risk factors does not guarantee the development of breast cancer, and many women diagnosed with breast cancer have no known risk factors. Symptoms of breast cancer. Lump or thickening. A noticeable lump or thickening in the breast tissue or underarm. It usually feels different from surrounding tissue and persists throughout the menstrual cycle. Sometimes it grows and becomes bigger. Changes in breast size or shape. Unexplained changes in the size or shape of one breast that is not related to hormonal fluctuations or weight changes is another symptom that shouldn't be jokes with. Skin changes. This involves changes in the skin over the breast. Changes like redness, warmth, dimpling, or puckering of the skin. The skin may resemble an orange peel, peau d'orange. Do not keep that to yourself. Nipple changes. Changes in the appearance or position of the nipple. Changes like inversion, turning inward, changes in direction, or discharge other than breast milk. Pain. Persistent pain in the breast or nipple could also be a symptom of breast cancer. While breast cancer is not always painful, any unexplained and persistent discomfort should be evaluated. It's important to note that breast cancer can also be asymptomatic, especially in the early stages. Regular breast self-exams, clinical breast exams by healthcare professionals, and mammograms play crucial roles in detecting breast cancer early, often before symptoms become apparent. Early detection. Regular self-exams. Being familiar with the normal look and feel of one's breasts helps in detecting any changes. Clinical exams. Regular checkups with healthcare professionals for clinical breast exams. Screening guidelines. Following recommended mammogram schedules based on age and risk. Mammograms. X-ray images of the breast used for early detection. Regular mammograms are recommended, typically starting at age 40 or earlier based on risk factors. Ladies below 40 years of age should also go for regular breast ultrasound scan to check if there's any changes in their breasts. Breast cancer staging helps determine the extent of the disease, guiding treatment decisions and providing prognostic information. The staging system commonly used is the TNM system, which stands for tumor, nodes, and metastasis. And it has 4 stages: stage 0, in situ, TIS, N0, MO. The cancer is non-invasive, limited to the ducts, DCIS, or lobules, LCIS, and has not spread to nearby tissues. Stage 1, T1, N0, MO. The tumor is small, up to 2 cm, and hasn't spread to lymph nodes or distant sites. Stage 2 has 2 substages under it, IIA, either of the following: T0 or T1, N1, MO. No tumor is found, T0, or the tumor is small, T1, and has spread to 1-3 nearby lymph nodes. T2, N0, MO. The tumor is larger, 2-5 cm, but hasn't spread to lymph nodes. IIB, T2, N1, M0 or T3, N0, MO. The tumor is larger, or it has spread to 1-3 nearby lymph nodes. Stage 3 has 3 substages under it, IIA, any of the following: T0, T2, N2, MO. No or small tumor with spread to 4-9 lymph nodes. T3, N1, N2, MO. Larger tumor with spread to 1-9 nearby lymph nodes. IIAB, T4, N0, N2, MO. Tumor involves the chest wall or causes skin changes and may involve nearby lymph nodes. IIAC, any T, N3, MO. Tumor of any size with spread to 10 or more nearby lymph nodes. Stage 4, any T, any N, M1. Cancer has spread to distant organs or distant lymph nodes. Stage 4 is considered metastatic breast cancer. Treatment options: the choice of treatment for breast cancer depends on various factors, including the type and stage of the cancer, as well as the individual's overall health and preferences. Here's an overview of treatment options for different types and stages of breast cancer. Surgery. There are different types of surgery depending on the stage of the cancer. Lumpectomy, breast-conserving surgery, removes the tumor and a small amount of surrounding tissue. Mastectomy removes the entire breast, can be simple, removing the breast tissue, or radical, removing the breast tissue and some surrounding structures. Radiation therapy, external beam radiation, targets specific areas with high-energy beams to kill or damage cancer cells. Internal radiation, brachytherapy, involves placing radioactive material directly into or near the tumor. Chemotherapy, systemic treatment, uses drugs to kill or control the growth of cancer cells throughout the body. Neoadjuvant chemotherapy, administered before surgery to shrink tumors. Adjuvant chemotherapy, administered after surgery to eliminate any remaining cancer cells. Hormone therapy, blocks hormone receptors, inhibits the effects of hormones like estrogen or progesterone that can fuel certain types of breast cancer. Common medications: tamoxifen, aromatase inhibitors, e.g., anastrozole, letrozole, and ovarian suppression. Targeted therapy, targets specific molecules, aimed at specific molecules involved in cancer growth. Examples: HER2 targeted therapies, e.g., trastuzumab, for cancers with HER2 overexpression. Is breast cancer completely curable? Not really. The percentage of cure a breast cancer patient will get depends solely on when he or she starts receiving treatment. Let's break it down. Early stage breast cancer, stages 0I, for localized, early stage breast cancer, surgery, lumpectomy or mastectomy, can often provide a complete cure when the entire tumor is removed. This is why you, or if you know of anyone with any of the symptoms, should not hesitate to see your healthcare provider's locally advanced breast cancer, stage 2-3, neoadjuvant therapy, administered before surgery to shrink tumors, increasing the likelihood of successful surgical removal. Shrink tumors, increasing the likelihood of successful surgical removal. Surgery and adjuvant therapies, followed by surgery and additional treatments to reduce the risk of recurrence. Metastatic breast cancer, stage 4, treatment as a chronic condition. While metastatic breast cancer is generally not considered curable, it can often be managed as a chronic condition with the goal of controlling the disease, prolonging life, and maintaining quality of life. Response to treatment. The response to initial treatment plays a significant role in determining long-term outcomes. It's important to note that advancements in breast cancer research and treatment have improved outcomes, and many individuals diagnosed with breast cancer at an early stage achieve long-term survival and are considered cured. Regular follow-up care is crucial to monitor for any signs of recurrence or new developments. Ultimately, the potential for a complete cure depends on the specific circumstances of each case. Do you enjoy this video, and would like to know more about your health? Then, like this video and subscribe to my channel.